Alright, so I am going to talk about Camp Dreamcatcher. It's a nonprofit organization. I'm going to talk a little bit about one of their programs, the team program, do some assessment analysis of that, give some suggestions, as well as assessing the leadership of the organization. First I'm going to start off, I'm going to go with the background, talk a little bit about the camp, how it came about, where it is, how it's got to where it is over the years. Then I'm going to go over the analysis of the current teen program. We're going to focus specifically on the teens. And when I say teen, I'm talking about ages 13 to 18. Then I'm going to go into some of the research I did about teen mentoring programs, trying to figure out what are the best practices. Then I'm going to talk about some of the research I did with HIV and AIDS and how to create a program specifically for teens infected with HIV and AIDS and what to be mindful for. Then I'm going to suggest some team programming that I'm going to provide for the organization. And lastly, I'm going to present some of my findings on the leadership assessment of the executive director of the camp. First of all, just to get started, I know a lot of people, HIV and AIDS, there's a stigma around it. So I want to get a couple things out of the way right away. Make sure everybody's on the same page. HIV, human immunodeficiency virus, that's what it stands for. AIDS, acquired immune deficiency syndrome. And what it is it's a virus that infects your immune system, and you can't fight other infections, other diseases that come on to your body. The difference between the two are when you contract the virus, it's HIV, and then there's something called the CD4 count, which is a certain level of your blood cells. They get below 200, then it goes into full-blown AIDS. So if you're ever wondering what the difference between HIV and AIDS, it's not really that much difference. It's just the count of their CD4. And so once you get to full-blown AIDS, you can never go back to HIV, but you can get your count above. But it's just a classification system. The virus is really the same in itself. The Center for Disease Control said last year there was 34 million people living with HIV and AIDS in the world. And then I put up the 4 fluids of how it's transmitted. This isn't trying to be a healthcare, trying to teach you about HIV and AIDS, but what I wanted to do is kind of break some of the myths around HIV and AIDS. So there's really only 4 fluids: semen, preseminal fluid, vaginal fluid, blood, or breast milk. So the reason I bring this up is because this drops the stigma a lot for people right away. You can hug somebody with HIV and AIDS. You can have them cry on your shoulder. You can hold their hand. You can have a conversation with them. You can play basketball with them. You know, there's not sweat on here. There's not tears on here. There's not sitting at a table. There's not breath. So I wanted to put this out there just so people are all familiar and on the same level playing field. So this is me at Camp Dreamcatcher. This is organization is very near and dear to my heart. I've been volunteering for 8 years at Camp Dreamcatcher for the week-long camp. The mission is provide safe and therapeutic services for children infected or affected by HIV and AIDS and their families, and to foster an atmosphere of tolerance, compassion, respect, and understanding through volunteer opportunities, services, and expanded community outreach. And throughout the presentation, I'll put some pictures of some of the kids in there, so it'll be nice to see. So the history started off, Patty Hilkirk, the executive director, back in 1995, she had somebody that was very close to her die of AIDS, and she started getting involved with the movement to find out more about it, and she found out that there's this population of children that are born with HIV and AIDS. And it really tugged at her heart. She got together with a couple people and decided, I want to give these kids 1 week where they can just be a kid and create some therapeutic environment. She's a therapist at heart. So she started with 41 children, 1 week camp in 1996. Then in the late 1990s, early 2000s, new medications came out. As the medications, so HIV and AIDS is relatively a new virus when you're talking about things that just came out in like early 80s. So these new medications allowed people to live longer. So now she had these children that were born with HIV and AIDS that were only making it to 9, 10, 11 years old. Now they're having medications that they're living to 12, 13, 14. The camp needed to expand services quickly. So some of the services that came out in the 2000s were now they do a winter reunion every year with a holiday outreach. They have 2 teen retreats throughout the year. They have a caregivers retreat. A lot of the children are living in the foster care system or with aunts, uncles, grandparents. So it's important to get their caregivers in to talk about, because a lot of them are living with HIV and AIDS. which is most of the way how the children do contract the virus. And then they also do education outreach programs. Now they have more than 170 children served annually with the help of over 250 volunteers every year this happens. The background of the teen program, 98, the medical advancements I talked about, so you start seeing kids were living longer. 1999, the CIT program, which was an opportunity for kids that were phasing out of the camper age to become counselors in training, give them some leadership skills. In 2001, they expanded the camp a little bit to go to 13 and 14-year-olds, a little puberty education. This is like kind of the first time kids were starting to live and starting to, okay, can I have sex, or what can I do? And I mean, all these questions that are coming up for these kids. So that was when that started. 2002, they started the official teen program with 13 and 14-year-olds. 2003, the first teen retreat, where they had all the teens come together and they said, let's bring them together, let's let them know that there's other people living with this virus. 2007, I think, was one of the best programs they had, the Teen Speakers Bureau. They actually allowed children, the teens, to feel empowered, that want to join on a voluntary basis. They can join this Teen Speakers Bureau, and they go out and they speak in the community. They speak at their high schools, different speaking engagements on World AIDS Day, and they tell their story. And that's part of that, educating the community about what's going on, and that's really empowering for anybody that's ever told their story in public knows how powerful that can be. 2009, they started the life skills training. Now this is for 18, 19, and 20-year-olds. This was actually brought on by one of the campers who said, I have no idea what I'm doing trying to apply to college, or I have no idea how to fill out this apartment application. And so we started realizing that they need a lot more help when it comes to what's going on. Presently, they're starting to see that there's a need for more than just this one-week camp. They have some of those other programs you saw, but there's a lot more needed. So what I did was, I got some people together in a room, got some teens, the executive director, the program director. There's only 2 staff members. I got some other volunteers with me, and I had the president and chair of the board. And we did a SWOT analysis, a stakeholder analysis, and a problem objective tree. So I don't know where you guys, Lord 10, where you guys are at in that, but it's a fun process. It's a fun process. We were there all day, and it really was a good learning environment for me. For the SWOT analysis, I'm not going to go over everything, but I just want to point out some things. The internal strengths, the returning teens, returning counselors, they're doing something right. They're drawing people in. People are being touched by the experience. I've been there 8 years. I take one of my weeks vacation, I only get 2 of them. I take one of them to go to camp. They draw you in. It sucks you in. So that's definitely a strength. External opportunity, I wanted to point out, other organizations that do things similar. When I talk about 2 staff members, I'll get into it a little bit more, but there's a lot of teen programming out there in the city of Philadelphia. So that's an important thing to keep in mind. External threat, obviously, shrinking resources, failing school systems. Philadelphia Public Schools are doing tough times right now, and the economy and the cuts from the state are affecting them greatly. So figuring out how to kind of navigate around that is very difficult. Some of the internal weaknesses, a big one right here, difficulty in planning new programs. It was something that this group identified, which was pretty tough if you're trying to give them recommendations on how to implement a new program. Something to keep aware. A stakeholder analysis. Now, I don't necessarily agree with all this, but this is where we came as a group to consensus. For teens, I think might be managed closely, but they felt they didn't want the teens to be stressed about the program part of it, and they felt like they should just be enjoying it. They wanted them to have a say, but they didn't. So we went over and kind of separated people into different places. So these are kind of some of the key players in the Philadelphia area and where we thought they fit in the stakeholder analysis. So we did our problem and objective tree. First we started off with what's going on with our teens right now. You can see, and that's up here, that's the branches of the tree. There's a lot of different things: drug and alcohol abuse, not taking medications, major health issues, loss of positive role models, dependency on social systems, limited job skills. And then so we try to go to the roots of the problem. That's as low as go. Lack of community investment in youth was one of the major, there we go. Provide supportive mentoring program. So what we did was we did the roots. So we said because of this, because of this, and they went up. And then on the objective side of it, what you do is you come up with solutions. to each of these problems over here, to the roots. And that's how, this is what creates the basis for your plan that you come up with. So the main goal walking out of the meeting was they wanted to develop a mentoring program. They had high hopes. Like I said, they have 2 staff members. They have high hopes. They wanted to develop a mentoring program to assist teens ages 13 to 18 in the Philadelphia area whose lives are touched by HIV and AIDS in completing high school. So they're debating, do we want college bound? Do we want, they said, you know what, let's do high school. Let's just talk about high school, and then we can expand services and grow on that. So people that want to get into maybe a tech field or something like that, so the mission is college or get into full-time employment. Next thing I did is I went out and I talked to professionals in the field that are working with teens right now. I did a lot of research, but I just kind of pulled up these 3 specific interviews just to give you a glimpse of what was going on out there, best practices. Judith D. Spangler is the Chief Program Officer of Big Brothers Big Sisters. She talked about 2 important things: volunteers, role models, and matchable, which is not a word, by the way. It's underlined red. So volunteers, she said, kids are going to need, they're going to take role models whether you like it or not. So we want to put good role models in place. That's the thought behind Big Brothers Big Sisters. They want to make sure that teens have somebody that they can talk to about anything. Now, they don't focus specifically on education. We just want a nice role model in their life. That's their main goal. And they said a key part of that is finding the right people. So recruiting, screening, training volunteers is huge. So she said that's a key part of any program. You need to have good training, and you need to get the right people in the right place. And matchable is, it's nice to have all the kids in the program, she said, but unfortunately, you can only have the kids that want to be matched. You're not going to have a kid, you can give them all the resources, everything you want, the teen's going to do what they're going to do. I mean, you can create the support network. So she said you have to understand that sometimes the teens aren't wanting to do it. So we only accept teens that want to grow. We only accept, so she said, keep in mind that when you're creating your program, you don't want to create something that's impossible to accomplish that nobody wants to join. Interview with Denise Hackney, Director of Upward Bound. She runs a program that helps kids at Catholic schools in Philadelphia get into college. And she talked about support networks, having people at home, having people in the school that are advocates, aware that the kids are in this program. She said that's huge. Having somebody that's checking in on the kid at home, making sure they're doing their homework, making sure they're going to sleep on time, making sure they're going to school with food in their stomach. She said a lot of kids don't have that. So finding an advocate in the area, finding support networks. Accountability, she said, is huge when you're thinking about programs because these kids are living in a society where you can pretty much do wherever you want, talk to whoever you want, text wherever you want, Twitter wherever you want, post a picture, post a video, 2 kids fighting, like anything can just get out there right away. So holding kids accountable by saying, okay, this is your opportunity to come here at this time, this is the homework you have to do, creating some structure in their lives. Don't just let kids just run free. She said, creating accountability, creating structure helps the students accomplish goals and move forward. The next is with Iris Ware. She's the Corporate Work Study Coordinator at Detroit Cristo Rey High School. Just quickly, the Cristo Rey High School model is, there's about 14 of them in the United States. And what it does is it gives students an opportunity to work 1 day a week. Instead of go to school, they only go to school 4 days a week, work 1 day a week. It gives them an opportunity to learn a trade, learn how to be professional. And what they do is they have 100% graduation rate goods into college. So what she talked about is professionalism and experiential learning. She talked about how that is the key component of their program, their high school, is that you need to get in there, you need to get your hands wet right away, you need to go in there and you need to learn how to be a professional. That's how you get into an interview, that's how you put together a resume, that's how you're going to communicate your skills when you're moving into college applications. She said, so that's huge. So we have all these best practices. Now we have to think about how are we going to tailor the program specifically to teens with HIV and AIDS. I talked with 3 more professionals. Dr. Rabah, she talked about the stigma of HIV and AIDS. She deals a lot with children. She said the stigma is just as bad as the virus itself. You have kids that can't talk to anybody about what's going on in their lives. You talk about thinking back to middle school where it's hard to even talk to a girl or think about this or and you're talking about how are you going to tell your girlfriend you have HIV or you have AIDS. This is a secret they hold and don't think anybody else around them might have it. So she said the stigma is just as bad. So creating an atmosphere that it's safe, it's okay, you did nothing wrong, this is who you are. Transmission. She used an infectious disease medicine. Transmission. She said kids are having unprotected sex. She said we cannot be letting kids make poor decisions, especially people that are infected or affected with HIV and AIDS. So she was very worried about making sure there's some sort of education in there that teaches kids about how to not transmit the disease. Changing virus, other infections, from Dr. Koenig. She's at this is LAC Center in Philadelphia, and they deal with HIV and AIDS. She talked about the virus that it changes and transforms, so medication adherence is important. So say I'm taking my medications every day, and I get prescribed the medications to the virus I have in me. If I don't take my medication for one day, then the next day I take it, the virus could have morphed overnight, and then the medications I'm taking are no longer affecting that. So she said kids are not aware of that. So usually she says it doesn't happen overnight, but it happens over weeks, months. She said, but it could happen overnight. That's how quickly the virus can change. So she talked about that's a very important thing that the teens need to know about. Also, other infections. So like I said, your immune system's way down. So what's actually affecting these teens is not really HIV and AIDS, but the common cold or flu, getting strep throat, things that happen to kids all the time. All kids get it. So she said that's a very big thing to look out for and to keep them aware of, that they need to create proper hygiene habits and be extra cautious compared to other teenagers. The last one I talked with was Sherry Gresto. She's a counselor at St. Chris, which is a hospital that we get a lot of recommendations from. And she talked about family networks, support groups, talking a little bit about what Denise Hackney was talking about with Upward Bound, is that it's important for people to know there's other people out there. The teens need to know. So she works with the support group there, and she says how powerful it is to have one teen talk to another teen about what's going on and how to connect with each other. So that's an important part. So for just a quick outline of the plan that I came up with for Camp Dreamcatcher is, first thing they need to do is look at their infrastructure. They have 2 staff members. How are they going to support this program? So in information gathering, they need to find out what resources they're going to need. I did a lot of the information gathering, finding out best practices. And then the financial plan, they need to figure out how they're going to fund this. So that's going to be a huge portion of their planning stages. The next thing is the community partners. I like the Detroit Cristo Rey, the Cristo Rey model. I think it would be important to create a mentoring program where you're getting kids into a work environment. Figuring out how they can partner with local businesses and local companies and already big funders to say, hey, would you be willing to take on an intern? And through that, you're going to create more funding from the organizations becoming more connected. And that will also create change in the stigma. You have these kids who are working in a work environment with people every day who are realizing, oh, they're just a teenager, they're not this AIDS person. So that changes the stigma, getting to know somebody that has HIV and AIDS. The next big thing is the mentor relationship, creating opportunities for mentor-mentee. So like once a week they talk on the phone, once a month they get together, creating like that outline for ways for mentors and mentees to connect. The next thing, program, training volunteers, how that's going to be crucial for their planning stages, is figuring out how are they going to train all these volunteers, how are they going to get volunteers in, how are they going to advertise for volunteers, what are the events going to be, so all that stuff has to happen. The additional networks are the home support and school support, so that goes back to kind of what Denise was talking about, figuring out who the advocates are in their home life or at school. For the mentor program itself, this is just a quick overview of some suggestions I had. They can plug into the weekend retreat still. They can plug in, their orientation can be during that week of camp. So this is ways to kind of cut funding and not have like this huge burden on them, but also be able to create a mentor program. So this is like low cost. And this talks about the 6 hours a week of on-the-job training that I thought was important from the Cristo Rey model. And then quarterly gatherings, getting the mentors, mentees all together at once so people can see each other, creating that support network. And then education, home life, and internship advocates. We talked about that a little bit earlier. For funding, they can continue to look for grants and donations, but also creating a mentor fee. So people that sign on to be a mentor make it also a financial commitment. To be a counselor at the camp, you have to raise $100, which isn't that much if you're thinking about some organizations. So it would be like $150, $200. So thinking creatively outside the box of how the mentors can raise the money. And then through those internship partnerships, creating a fee for these community partners. If you're going to bring on an intern, you have to give the organization, make a financial commitment, make that partnership. both ways. For the challenges, dependency on volunteers, like I said, only 2 staff members. The community involvement and the funding, I think, is going to be huge. Trying to, especially startup, how are you going to find that first organization that's willing to say, I want to bring on an intern? Because, you know, with nonprofits, you have to, it's all, I want money, you have to show all the results of what you've been doing great. And if you haven't been doing any mentor program, it's going to be hard. So that startup, I think, is going to be tough. And the staffing, once again, is going to be an issue. For goals and impact measurement, they want to create a program that our kids are graduating. They're getting into college or full-time employment. They're living healthy lifestyles, healthy relationships, increased community awareness. I think these are the key points of what they're going to want to assess as they're going through their program to say, are we accomplishing what we want? Lastly, I want to go over the leadership assessment of the executive director. I had her fill out 3 self-assessment tools, and then I used 2 external assessments, a 360, and actually somebody wrote a chapter about her in a leadership book, Sosik and Jung. So for the Engel leadership profile, she was a big team player, but she was also pretty strong. And then implementation, starting new plans, programs, she was a little bit lower. So I think you can see she's good at cooperating readily with others to carry out visions and plans. She's a very visional, vision ahead. Like she's on top of figuring out where she wants the organization to go, but how to get there. So, and then also getting on those tasks and other things. Path goal. She scored high in directive, participant achievement, average in supportive style, strong balance in leadership styles, but she needs to find ways to support staff and volunteers. So she's been running this organization for almost 15 years now. How is she figuring out how to bring other people on board? So I think you're going to start to see a little theme here. The leadership style indicator, pioneering, strategic, management, team, encouraging, average, and pastoral care. She's not bringing those people. She's not getting those volunteers to be part of running the organization. How does she empower her staff? So you can see that she's a very strong leader. She has all these great traits, but there's some areas that she can definitely grow in. For the 360, we asked teens, board of directors. We did not all the teens. We had, I think, 8 teens filled out the survey. Current and former staff, funders, and volunteers. And we gave them a quick questionnaire, 1 to 5 on 8 categories. And you can see for vision, strategy, inspiration, team building, relationship, and we had a question that was related to each of these things. And as we said, rate them on how is she on X, Y, and Z. She scored average in task management, execution, and communication. So you can kind of see she's not low in anything. She's really high up on a lot, but the average pieces tend to be task management, supporting others. How is she going to grow? How is she going to support the networks around her that are already in place? Sosik and Jung, what they came up with in their full-range leadership development pathways for people, profit, and planet. They identify Hillkirk as a transformational leader. They talk about how she looks at something like HIV and AIDS and thinks about opportunity. She takes something that's so negative and makes it into such a positive experience for everyone, especially that week-long camp, and help keep sucking people in. So they're saying this is transformational leadership at its best. They said she is shifting society's views on HIV, AIDS, from focusing on helping patients who are dying to living with disease. Lastly, I wanted to just bring it all together. The conclusion is working with Patty over the 8 years and seeing how some of her self-assessment and then looking at the 360, she has great leadership qualities. And she has brought this organization from just this dream in 1996 to touching thousands upon thousands of lives of the different volunteers who have come in over the years. She's changed the way a lot of people view HIV and AIDS, especially me. So I think she's doing some great things, and she has some very strong areas. The growth areas, I think, how is she going to implement this mentoring program? How is she going to use that leadership of the average and the task and supporting people? How is she going to grow in those areas to get this mentoring program from that vision to an ongoing thing? How are they going to have year-round programs for teens? So she needs to grow in those areas to figure out who are her people around her that she can support and grow that can support this network. Especially there was one comment from a board member that said, what kind of planning is she doing for who's after her? Because it's run all around her. What kind of succession planning is she doing? And then specifically to the teen program, I think what they need to do is partner. One of the big things, there's lots of organizations that are serving teens, especially in the beginning, low staff members, the funding problems. They can find mentoring programs they can plug into. If they do start their own, I think start small. Don't think we want to have 20 teens the first year. Think 1 or 2, or think 3 or 4. Try to get something off the ground and running, and then you can move forward. So I think that will be the key to success for the teen programming. And that's all I have.
Comments?
Okay, I'll ask.
Yeah.
How did, I think you said you chose yours by a process of elimination. You couldn't do government, so you went church, right? How did you decide to do your program, your project on that particular program?
Yeah, so I work for a nonprofit. I volunteer with a couple other nonprofits. So this one was, I think, one that was one of the first ones that kind of changed how I viewed who I was. So I think it had something deep inside me, but also I see such great potential there. I see all these great volunteers that are so caring about all the teens, and then I know the teens, I know their names. You know what I mean? I can see how these kids every year that don't come back to camp, that get locked up, that drop out of school, they get involved in gangs, and I think, man, they were so close. Like I knew them when they were 11. So there's just this gap, and I see it, and I think they realize it, and so I want to try to give them an opportunity to make that connection.
Is the camp connected to does it have a faith ministry or background, or it's a secular organization?
Yeah, it's completely secular. Yep. Which was
That might be a good component to.
I did some of the leadership, like we were assessing leaders and faith in the beginning, and I did an interview with the executive director talking about her faith, and she talked a lot about there's a Native American spirituality that was founded with the Dreamcatcher and where that is, and so she likes to see, like, the camp, that was her vision, was to bring these inner city kids out into the environment and to be healed by Mother Earth and things like that. So she was there was that essence of spirituality there for sure.
There's a resource for you as well. A pastor, you might know her, Pastor Ingram from St. Michael's in Germantown. She's writing a book right now, but her life story includes a very deep personal connection with her journey with HIV/AIDS, and she's a great resource and can speak both secular and faith-based stuff. And I can give you that.
That's awesome. Yeah, definitely.
I think I'm more of a comment than anything. You were talking about your director, and she has these great qualities, but doesn't have what it takes to walk it out and get it done. I'm curious about those 2 paid staff members, and is anyone there that's trainable, teachable, promotable that you could, because a lot of times your visionaries they're just not wired up to do the ba-dum to get it done. But what about the paid staff, and could you raise up someone there or bring someone in? Because you're going to need that. I'm just seeing that. I don't know that you retool her to get to all that stuff too. So
yeah. So in the strategic,
I'm just looking at structure.
No, yeah. The strategic plan I wrote for them. I did have them hiring another staff member to support.
Okay.
But it's she can see that. She can see that that's needed.
Right.
But it's this baby steps of how do you move? How do you can't. You know what I mean? So it might be if you get a $40,000 grant, you can maybe do something like that. But if you don't, how can we get 2 teams this year? So it's like, how is she going to make that jump? So I think that's definitely a
what about
key
your
piece of
volunteer
it.
base? I mean, you said you've been coming back for 8 years. Are there any others like you that keep
Absolutely.
coming back?
Oh, yeah.
And does somebody have those skills, that they're managerial type skills versus she's more leadership and vision, where that's kind of the next line of that.
That's
So
what I'm that's what I'm saying.
somebody needs to be looking at people there and
So I was saying, how does she
somebody
get
in.
these people that have been coming back? How does she get
who's
them
got
motivated
it?
to do it? Yeah.
Somebody's got it.
I think it's close. I think it's definitely
Yeah, it's
close.
cool.
Somebody over here had a question or a comment?
Go ahead.
Where is the camp?
It's actually located in, this year it was at Westchester. They rent a camp every year.
Okay.
So this year it was actually in Westchester at West End School. But years past it's been at Camp Saginaw in Southern Chester County in Oxford.
Okay.
But it's just 1 week in August where they do that. And then they rent retreat space and stuff like that. So she has a whole other plan about getting an actual campground and partnering with other organizations that serve children with various disabilities, and so that all these different nonprofits can have, because there's a lot of nonprofits that have a week-long camp, Hole in the Wall and Bright
Right.
Feathers. And so they could all have one campground, and then they split up the weeks and work that way. So that's her. She's.
I feel bad that in the 90s you would hear about kids being born with AIDS, but not as much anymore. Like I know there's people out there getting AIDS still as adults, but I don't think much about. I mean, anybody else with me that we used to hear about that all the time, and now anytime I hear about kids being born with AIDS, it's not here.
Yeah.
It's not in the United States.
I think when I first started volunteering, people were like, "Oh my God, you're gonna get AIDS or whatever," and then now they're like, "Oh, I thought AIDS was cured." Or, you know?
Well, yeah, that's what I mean. Like, you don't really hear too much about. So there's still. So what you're saying is that there are many.
Still an epidemic, absolutely. Yeah, for sure.
And real quick, what's the SWOT analysis?
Strengths, weaknesses, opportunities, and threats.
And you'll learn all about
Wait, that's
that
what I figured we were learning about it,
strategic
but I was like, all right.
I saw like really amazing how the mission changed as the healthcare has improved
Yeah.
with that organization. I mean, it's still probably a heartbreaking challenge, but seems to be some hope to the community that, wow, we have to add something to our mission because these children are living longer.
Yeah, I think she was. She said, "I imagine this camp with all these little kids playing and fishing," and she says, "And now there's 40 teens that are talking about drugs and sex," and she's like, "I just never even bringing in all these counselors from from all these places." She's like, "I didn't even think about the 15 years ago." So it really has the environment has changed who the population that we serve.
Final question?
I just wanted to make a comment. I saw that you chose to use like the tree as a building block for and yours seemed to be more strategic. Like this is the beginning, this is what we need, this is what our action, this is the need, this is what we need to do, and then this is how we need to do it. And they're both very strong models to use. I was just wondering, they both get the job done, but I was just wondering what made you choose. I was helping my mom get to my house. So she dropped us off. So if you could let me know, I don't know if you said why you chose that model.
No, I didn't say. I actually, it was an expansion from strategic planning class where we used that tool, and so I kind of used it in that atmosphere, and so I wanted to expand a little bit on it, but also I think it gives stakeholders a way to give their ideas, and it's the whole base of where the plan comes from. That mentoring program to help kids graduate high school, that was the trunk of it. And that came about from people putting Post-it notes on the thing. And so people were involved. So I thought that was a way to give people a physical way to get involved, give their voice, and then make a plan kind of tailored to that.